You may or may not have seen the commercials boasting a new approach to healthcare. And yes, direct primary care has grown in recent years. Hi there, my name is Sarah, and I'm here today with iHealthBrokers to discuss the pros and cons of direct primary care. Stay tuned. Direct primary care is sometimes known as concierge healthcare, and it's grown in popularity since the mid-2000s. Now, because it's not traditional health insurance, it's even more so important that you understand exactly what you're getting yourself into before you take the leap. So watch this video, do your research, and if you decide that traditional health insurance might still be for you, or maybe that's just something that you want to learn a little bit more about, make sure to check out our channel because we've got plenty of videos about more traditional health insurance, as well as ways to save money on traditional health insurance. And of course, if you have any questions, you can reach us here at iHealthBrokers either in the comments or by giving us a call at 888-410-0344. We're licensed nationwide and there is no charge for our services. Now, as a reminder, please subscribe to our channel. We do release these videos on a weekly basis. We want to make sure that our clients and our viewers are as well informed as possible because your health is not something that you want to mess around with. So we want to make sure that you're informed and making the right decisions. And of course, please make sure to like this video. That way we can get this information out there to others in need. And if there are any videos you'd like to see, you can let us know in the comments below. All right, let's dive in. So what is direct primary care? Well, it's not health insurance. It's an agreement made directly between patient and healthcare provider. So instead of paying a carrier a monthly premium, you're going to pay a fee, usually on a monthly basis, directly to your provider, which is usually your primary care physician. Usually this is about $100 per month, and very often there are discounts available for families. Now, oftentimes, this is the only fee you'll have to pay. Very often when you pay this monthly fee, it'll wrap up your in-person visits, telehealth, any lab work that you may need, etc. However, sometimes there will be an additional fee. Some physicians do charge an additional fee when you actually take advantage of those in-person visits, but that's really not as common. So since you don't have to worry about deductibles, co-insurance, and co-pays, it's certainly much easier to understand your bill. Also, you'll usually have access to your doctor not only in person and via telehealth, but very often you'll have access to your doctor via email and phone, which can lead to a more personalized approach to healthcare. So what's the catch? Does this sound too good to be true? I mean, it's pretty inexpensive. You have a personalized approach, maybe a broader access to your doctor on a more regular basis. Well, it's not perfect, and it doesn't cover everything because direct primary care is really only going to cover your visits with your primary care physician. So it's not going to cover things like specialists or urgent care or hospital visits. And let's be honest, those are the expensive things. Those are the medical bills that really stack up. So you won't actually have any coverage for the more expensive part of your health care. Now, you definitely do not want to be without coverage for these types of services. Again, these are the expensive services. So that's why most people that are involved in direct primary care agreements, they still have supplemental coverage of some type, either a high deductible health plan or some type of catastrophic coverage. These type of plans will provide you with coverage if you need to visit a hospital. They'll impose out-of-pocket maximums. You can have prescription drug coverage. You can make sure that you can still go to urgent care and see a specialist and have some type of coverage. But that means you've still got to pay a monthly premium. Now, you can choose to go the high deductible health plan or HDHP route. You're going to have a higher deductible, but much lower monthly premiums. And since you're receiving most of your basic services through your direct primary care agreement, this shouldn't really be an issue. But you're still going to have coverage for those larger medical bills. You can also enroll in some type of catastrophic coverage. Now, some people actually may be eligible for what's considered catastrophic coverage through the marketplace. If not, you can look into a short-term medical plan. Short-term medical plans are much less expensive and they're highly customizable. So you can get one that's not going to cost you a whole lot on a monthly basis, but is still going to cover you in case you have major medical bills. So certain types of catastrophic coverage and high deductible health plans can be found on or off the marketplace. So you can look at healthcare.gov to explore your options. For short-term medical plans, you're really going to need to go through a broker. Another major drawback is that, well, it may not be available in your area. These types of agreements are not available in every state. And even if it is available in your state, your doctor that you prefer may choose not to participate in such an agreement. Now, if it's something that you're interested in, you can check out the Direct Care Coalition at dpcare.org to see if there is a provider in your area. This sort of agreement may work great for you. However, you may find that when you factor in your monthly fee for your direct primary care agreement, in addition to some type of monthly premium to handle your other medical expenses, it may end up being more expensive than enrolling in a traditional health insurance plan, or perhaps comparable and maybe it's just not worth the hassle. Or it might not be available in your area. If that's the case and you're looking into more traditional health insurance options, there are still plenty of options available that we can help you save money with. You may want to look into a high deductible health plan with an HSA, or you could look into a short-term medical plan all on its own because they are very customizable, some even to the point that they're comparable to marketplace plans. You can have access to a very large plethora of benefits with a much lower monthly premium. And then of course you can still look into marketplace plans. Just make sure to try to lower your MAGI so that way you can become eligible for one of those premium tax credits. It'll save you a lot on your monthly premiums, possibly thousands. And we do have videos dedicated to all these different topics. I'm going to put them in the description below, but just make sure to check out our channel because like I said, we've got plenty of videos about health insurance, FAQs, as well as ways to save money on health insurance. So have you tried some type of direct primary care agreement? How has it worked for you? Let us know in the comments below. And if you have any questions, you can reach us in the comments or you can give us a call here at iHealthBrokers at 888-410-0344. Now, of course, we can't help set you up with a direct primary care agreement because it's not health insurance. But if you have any questions about health insurance, or if you're looking for one of those supplemental options that we discussed earlier in the video, we can absolutely help you with that. Or if direct primary care is not available in your area and you're looking for a low-cost option, we can help guide you towards a plan that's right for you. And like I said, there is no charge for our services, and we are licensed nationwide. Healthcare is ever evolving, so please subscribe to stay up to date because we do release these videos on a weekly basis. And please make sure to like this video so we can get this information out there. Thank you so much. Have a great day. Bye-bye.